The Cook Wayne Pneumothorax Pigtail Catheter Kit consists of a large and small access needle, syringe, guide wire, lidocaine, scalpel, dilator, a 14 French pigtail catheter attached to a 3-way stopcock, stylet, and connecting tube. Discard the Heimlich one-way flutter valve. Prepare your pigtail catheter by inserting the stylet into the pigtail catheter to straighten the tip. Attach the stylet to the catheter via the Luer lock connector. The patient has been placed in the lateral recumbent position with the head of the bed elevated to about 40 degrees and the ipsilateral arm held over the patient's head, either with tape or an assistant. The fourth intercostal space at the anterior axillary line has been sterilized, draped, and anesthetized at the skin, subcutaneous tissues, periosteum, and parietal pleura at the superior aspect of the rib to avoid the neurovascular bundle. Target insertion just posterior to the pectoralis muscle, but anterior to the axilla. Make an incision in the skin using a stabbing motion, inserting the scalpel 2/3 its length. Insert the needle over the superior aspect of the rib while continuously aspirating. Advance the needle, stopping when the syringe plunger gives way and the syringe barrel fills with air, indicating you've entered the pleural space. Remove the syringe from the needle. Using the Seldinger technique, insert the guide wire and advance just enough to pass the tip of the needle. Remove the needle while securing the guide wire in place. Feed the dilator onto the guide wire. Advance the dilator using a twisting motion into the pleural space. You may feel the dilator give way after meeting some resistance. This step may need to be repeated to create a track for the catheter. Remove the dilator. Feed the prepared pigtail catheter with stylet and stopcock onto the guide wire. Advance until you reach the second marker while keeping hold of the wire, ensuring the last hole is within the pleural space. Remove the stylet and guide wire as one, leaving the catheter and stopcock in place. Attach the connecting tube to the stopcock. Connect the water seal chest drain to the connecting tube. Suture the catheter to the chest wall, apply a dressing, and obtain a confirmatory chest X-ray.